to you.
Thank you, Mark. Thank you. And it's nice to be here, and thank you for inviting me. And it's nice to see all your faces. This is a very important issue and a wonderful gathering. Contextually, moving from a School of Public Health to the U.S. government has been an interesting venture. From a standpoint of evidence, it's also been interesting. The way I would think of evidence as a professor of public health and the way I'm looking at it now as informing what has now become exciting and new U.S. policy is different. And so I'll speak into the latter difference. One is the policy itself essentially focuses on 3 core outcomes, and then it has 3 process objectives. One of the 3 core outcomes is protecting children. And it seeks over a 5-year period of time to produce significant reductions in violence and exploitation against children in a specified set of countries to get started in. The other supporting objective is that we want to move forward with evidence-based policy and programming. We want evidence to to inform what we fund. And that takes us, I think, into this discourse. I think first, we want to work to make sure that governments in the world, including our own, are responsive and responsible for these concerns. And in low-income countries, I think that means beginning and making sure that a government has an active surveillance system. And I would, in simple terms, define surveillance as containing 3 things. One is a government has to know how big the problem is, and so that's the prevalence surveys. 2 is it has to really understand what causes these problems, so causations. And then 3, it really needs to look at what are the most efficacious responses to responding to these problems. And it needs to know that not only in terms of producing positive outcomes, in this case prevention, but what are the costs of these? What are the costs of not doing these programs and whatnot? So surveillance to me is a very active term. And even in a country like Tanzania, for example, which has gotten praise for the work of CDC and UNICEF and Together for Girls and others have engaged the government, or the government's engaged in a very constructive way, the job's not over in terms of surveillance. It's just begun. They have to repeat these things. They have to keep the information. So when we think about investing, we need to think about continuing to invest in surveillance. And I would say, for example, in CDC's excellence in this area, it is a world-class center of excellence in this area, and we need to make sure that it remains active and robust as we discuss financial cliffs and perhaps less funding moving forward in, say, fiscal year 14. In terms of evidence then, it strikes me that when I speak to members of Congress, for example, and they're very excited about the action plan, and it's like, how can we support it? And they're openly saying, we're not going to have more resources, so how do we use more efficiently the resources we have, and how do we target towards these 3 outcomes? That's essentially the discourse. I'm struck with the following things, that when it comes to knowledge in this area, the vast majority of what we know comes from the United States, North America, and Europe. But we only represent about 5% of the global population. So we begin with a structural problem. If we go back to what Marta had to say earlier as she was describing violence in different countries, we know that these contexts and these cultures are different, and many of those contexts and cultures aren't necessarily robustly represented in Europe or North America. And then when we look at what actually protects kids, it's the same thing with health systems in a sense. Probably 70–80% of the day-to-day protection burden for children happens at the household level. So we're not really able to say with the sort of certainty, with knowledge, with wisdom, that we know what works in these vastly different contexts. So I would say, 1, we need to shift the locus, the contextual locus of where we're doing research. And then 2, if we look at the difference maybe between evidence and knowledge, and to inform policy and funding at large levels, we need to go beyond project knowledge, for example, or project evidence. We need to shift. I think we do have some good information on particular interventions and projects that have been subjected to rigorous research, and we know in one instance, for example, a program in Burundi is producing positive results by strengthening the economics of the households and then putting sort of positive parenting in the midst of that. But we don't know the extent to which these sorts of interventions across different contexts work. So I'm suggesting we need to move more into the efficacy trials. We need to move more into developing a much larger and consistent and robust sort of research effort that would span several years and would provide us with that information and move us from project level evidence to knowledge across the sector, I guess is what I'm arguing in favor of. It doesn't mean we stop acting. It doesn't mean we stop doing. It means we inform better what we're doing over time.